Live in the CNN Newsroom, Heidi Collins.
President Barack Obama's prescription for change, a sweeping overhaul of the nation's health care system. It sounds like the Clinton efforts of the early 90s, except for one big difference. Old foes are now supporting some of these changes. CNN national political correspondent Jessica Yellen has the details.
It is our responsibility.
Sound familiar? A Democratic president is vowing to overhaul the health care system.
We can no longer afford to put health care reform on hold.
The administration's budget director tells CNN he's optimistic it will get done this year.
We're going to try to avoid the mistakes of the past and not lay down a fully detailed plan, but rather work constructively with Congress.
It may not be a pipe dream. Remember those Harry and Louise ads which killed President Clinton's ambitious health reform plans?
Another billion-dollar bureaucracy.
Well, the same business and insurance groups that fought the Clinton health care effort are pushing Congress to pass reform now. Can you imagine an insurance industry spokesman saying this in the 90s?
Rising healthcare costs are putting a burden on individuals, small businesses, and families across the country. The most expensive thing we could do is nothing at all.
The president has started laying the groundwork for reform. His stimulus package provided the first steps with billions for electronic health records, research on efficiency, and community health centers. The budget calls for creating a $634 billion health care fund over the next 10 years and would pay for it in part by raising taxes on the wealthy beginning in the year 2011. Saving on Medicare with more competitive pricing on insurance plans, and reducing the cost of prescription drugs in part by encouraging more use of generics. Not everyone likes this roadmap to reform.
The question is, how do we get to that goal? When you look at the president's plan, it puts the government in charge of delivering this.
Several groups of senators have been meeting on a weekly basis to hash out just what health care reform legislation might look like. And the White House is holding a health care summit next week, so we should learn more then. Jessica Yellen, CNN, Washington.
So how are the president's plans playing in the trenches with real people trying to find a balance right now? It's our snapshot across America today. From Columbus, Ohio this morning, Laura Walker, she's a mother who is about to lose her insurance. In fact, tomorrow. The hip-hop doc, Dr. Ronnie Whitfield, is joining us from Baton Rouge with a doctor's perspective, and from Washington, Kenneth Thorpe, the chairman of Emory University's Department of Health Policy. Laura, I want to go ahead and begin with you. So tell us quickly the story. You're about to lose your health care coverage tomorrow.
Yes, through ABX Air, where I was employed with DHL pulling out.
So you lost your coverage just like we've been reporting here, and Elizabeth Cohen was saying people are losing their jobs, i.e. losing their health care. Why is this important to you specifically? I'm thinking about your daughter.
Well, my daughter last June 7th was swinging her leg off the horse when her right leg, when her left knee literally blew apart, tore her ACL, MCL, meniscus, and fractured her tibia. And she has been in 3 different hospitals, surgery. We've had all sorts of treatment. I cannot pay that portion that the insurance doesn't cover.
Well, do you even have any idea of what your total overall medical bill at this point is?
No, it's a little too scary to look at.
Yeah, I imagine. So what are you going to do?
Well, right now, the goal is to hang on to my home, and I would hope that President Obama will keep his promise and look to the Americans. Like, I would love to become a member of the health care reform team because I have struggled with this health care issue for 12 years. And this is not a new problem, and I have a lot of good ideas. Washington really needs to think outside of the box and get help to people instead of trying to beat something to death and make it perfect.
President Obama, Laura Walker wants on your team. All right, Laura, thank you so much for sharing your story. I want to get now to Dr. Ronnie Whitfield. Ronnie, I know that you see a lot of indigent patients as well as those who are privately insured. Specifically, what are you seeing out there?
Physician frustration. I just left prison, which is the only group of people in this country that are guaranteed health care. We're seeing lower...
How crazy is that?
Oh, interesting. But we're seeing lower reimbursements. Physicians are relocating to areas where liability insurance is cheaper. There's major problems in this country. I think one of the good things about the policy, and not saying that it's flawless, is that The physicians are involved in creating the healthcare reform policy with Senator Kennedy and the transition team. So we will be actively, or play an active role in hopefully forming something that will help America and help our country.
One of the ideas, in fact, that you like is this idea of minimum coverage for all. Like pay what you can pay and then provide sort of a minimum standard for everybody.
Yes, every American in this country, the greatest country in the world, should have some basic form of health care coverage. On a day-to-day basis, my nurse spends hours, ungodly hours, pre-authorizing prescriptions or appointments, and we're wasting time. Instead of doing health care, we're doing more sick care in our country. So it's time. We have the best doctors, the best nurses, the best hospitals in the world, but it's time for us to start taking care of patients. Doctors need to practice medicine, patients need to be patients, and insurance companies need to reimburse us for the services that we provide.
Aha, insurance companies. All right. Our hip-hop doc, Dr. Ron Whitfield, thanks for your story as well. The president's health care plans bring back memories of the Clinton administration's health care fight. And we saw a piece on that just a few moments ago by our Jessica Yellen. Emory University's Kenneth Thorpe helped work on those reform efforts as an assistant secretary at the Department of Health and Human Services. Right now, we have no HHS director or a surgeon general, which is interesting to me. But Kenneth, tell us, if you would, is this going to work? Is it going to be enough money, $686 billion, I believe, pardon me, 36, I think it is, over the next 10 years to overhaul health care?
Well, it's a very substantial down payment. I think he's got us almost all the way there, 60–70% of the funding needed to do this. But as you mentioned, what's happening this time is so fundamentally different than 15 years ago.
How so?
Well, you heard Peter Orszag talk about the fact the administration was not going to come out with a detailed plan. Rather, the Congress is taking the lead, and particularly in the Senate, in putting this plan together, in order to make sure that you can do this as much of a bipartisan way in the Congress as possible, with input, as you've heard, from consumers, business groups, and healthcare providers. So the process, which is so important in Washington of doing this, really is quite different this time around, and it leads to some optimism we can get this done this year.
Are you optimistic about it?
I'm very optimistic. I think that there's a president who wants to get this done. They've learned from how this went down 15 years ago.
Yeah.
I think many members of Congress are certainly motivated to do this. Senator Kennedy, this is his legacy issue.
Is it a lot more expensive this time around?
Well, it is. I mean, had we fixed this problem 15 years ago, it would cost everybody who has private health insurance today substantially less. So it's like anything in healthcare. The longer we wait to fix it, the more expensive it's going to be. So I hope we can get it done this year.
Are we talking about universal health care ultimately?
Absolutely. You just heard from one of your patients there with cancer that this is a major economic issue. If we don't get everybody coverage, we're going to continue to find people who file for bankruptcy, who lose their houses, and obviously that just accelerates a lot of the economic issues that we're facing. So we have to finally step up to the plate to make sure all Americans have health care. And the thing that they're talking about is private health insurance. So I think there is a compromise position to do here, but as you mentioned,
affordable private health insurance.
Affordable, and underscore that.
All right. Well, we sure do appreciate your story as well. Kenneth Thorpe, thanks so much. And also thanks to Laura Walker in Columbus, Ohio, and Dr. Ronnie Whitfield, the hip-hop doc in Baton Rouge. Thanks, guys. Sure do appreciate it. It looks like any other ski resort in America, except for one big